Welcome to Your Healthy Kitchen from Dignity Health Yavapai Regional Medical Center.
Welcome to Dignity Health, YRMC's Your Healthy Kitchen. I'm your host, Rita Carey Rubin. Caring for a loved one with memory issues can be profoundly fulfilling, and it can also be an emotionally overwhelming, physically challenging, and even isolating experience. Because of that, we know that self-care is essential for caregivers. Adequate rest, physical activity, nutritious meals, and good medical, social, and emotional support are important for patients and for the people who care for them. So I have two wonderful guests here today to share their experience of working not only with patients with Alzheimer's and dementia, but also with their caregivers. So Dr. Sam Downing is the Director of Geriatrics and Palliative Medicine at Dignity Health, Yavapai Regional Medical Center Group, and Christina Gettens, Doctor of Nursing Practice, is the Director of the Dignity Health Alzheimer's and Dementia Care Program. Welcome.
Thank you.
Thank you very much for having us.
Thank you. So good to have you here. Thank you.
Yeah.
Thank you for taking the time to join us.
Of course.
Yeah. Christina, I'll start with you. I've read an amazing statistic that 75% of caregivers are family members, caregivers of individuals with dementia. Are caregivers, mostly unpaid,
Yes.
large majority unpaid, and are women. So a lot of folks out there doing some really hard work.
Oh, yes.
Yeah.
Absolutely.
So tell us about your program. You're a geriatric
Nurse practitioner.
Thank
Yes.
you.
So I'm a
Yes.
nurse practitioner. I received training through UCLA over in California to become a dementia care specialist. So we have the Alzheimer's and Dementia Care Program. For short, we call it ADC. But essentially, we offer an additional layer of support to individuals with dementia and their caregivers, so the dyad. We're looking at not only addressing medical issues that arise, but also any behavioral issues that can occur and any social needs as well. So we aim to offer support not just for that individual with dementia, but the caregiver becomes a key player, if not the most important player as time goes on for someone with cognitive impairment that is unfortunately progressive. So we just aim to help in whatever way that we can, whatever that looks like.
Yeah, it's a holistic program.
Yes.
For both the caregiver and the patient.
Absolutely.
Yeah.
Absolutely.
And Sam, you have been an amazing caregiver in this community for decades, and have a unique experience with working with families of individuals with dementia. And I wonder if you could comment on how having a family member care for someone really affects the quality of life of that person.
Right. Well,
Yeah.
and one of the things that we've been very fortunate to do both in Christina's program and the program that I work with, which is palliative medicine, is to do home visits. And as we do home visits, we find some amazing things going on in the community, but particularly around dementia or cognitive impairments that are limiting people's lives. What happens is their lives tend to really get smaller and smaller and smaller. They don't go out as often. They're not comfortable engaging in social experiences. And so the caregivers get into those situations as well, where their worlds start to get smaller and smaller and smaller. And so they tend to get isolated. And when they get isolated, they really, I will say, can run into neglecting themselves. And so there are risks related to self-neglect, or the caregiver spending so much time focusing on the individual with dementia that they're not taking very good care of themselves. There are two sort of unique things about dementia, I think. One is the course can run a long time, from the time of diagnosis sometimes to the time that a person might either be institutionalized where they need more care or even pass away from that condition. That can be 10 or 15 years sometimes. And so the length of caregiving responsibility can be really quite extended. And so that would challenge anybody, but certainly if it's one family member that's challenged with that, it becomes very challenging. I think the other component is really that people with dementia do best at home. I think if we asked ourselves where would we like to be with any condition, but certainly as we develop cognitive impairments or things like that, most people want to be at home, and they want to be with people that they know, that they recognize, that they love. But those relationships are changing. So if I'm a spouse for somebody who has dementia, my relationship as a spouse, as I'm providing more and more care as that condition develops, is becoming more of a caregiver, less of a spouse. Even to the point sometimes, and this is tough, but it does happen, where caregivers are not even recognized as my spouse. They may forget who their wife is or who their husband is or whatever.
Yeah, incredibly stressful for the caregiver.
Absolutely.
Yeah.
And I don't know if this is actually, true, but I'll mention it, and that is, you mentioned that the majority of caregivers are women.
Yes.
But a lot of men caregivers are out there struggling to learn new roles and new tasks and things that they've never actually been in that role before.
Yeah.
And so caregiver training is something that Christina does too, along with the support piece, is how to help somebody who's never been a caregiver manage the care that they might run into.
Yeah, what a wonderful support piece right there.
Yeah.
Yes, doing something you have no idea what's involved in it until you do it.
Oh yeah.
Yeah.
It's a whole new ballgame.
Yeah. Well, I know, as a dietitian, I've really seen how important it is for caregivers and patients to eat well. Right? Doesn't always happen. It's very hard to make that happen sometimes. And having some strategies to streamline meal preparation can make it much easier to enjoy healthy homemade meals more often. And so one of my favorite tricks is to make one pot or one pan meals where most of the cooking is done in a crock pot or an oven. There's a little bit of prep work, but most of the cooking is completely hands-off, so you're free to go do other things, maybe even take a break. So would you guys mind helping me put together a sheet pan supper while we talk? All right.
Happy to.
Excellent. So a sheet pan supper is just a template. This is a super easy recipe, but the idea is that the meal is all cooked on one pan, and it's just usually some basic ingredients. So for this one, we're going to use some broccolini. And Sam, I'm going to ask you to cut that
My job?
maybe into bite-sized pieces. And broccolini is just like a skinny broccoli. It's a little sweeter than broccoli too. But if you just have broccoli, that's okay too. I would just cut it in smaller pieces. And Christina, if you would cut those tomatoes in half.
Yeah,
So we've got broccolini, cherry tomatoes. I'm going to slice up an onion and some lemon. And those are the main ingredients for this.
Sounds great.
This dish. Also, we're going to put some feta cheese on it.
Okay.
Yeah. So Christina, since you're out there working with the caregivers, and we know that it's a really stressful job, what sort of self-care practices do you encourage? How can you and your program support those people?
So, great question. I always encourage my caregivers to take adequate time for respite. So, essentially encouraging them to take a break, to get out of the house, go for a walk, go for a hike, or even just attend their own medical appointments, just prioritizing their needs.
Yeah.
So, getting that opportunity for respite can sometimes be challenging, of course, but there are different ways in which we can help. My program can help just in educating caregivers on the different resources available, like caregiver agencies. There are some great adult daycare programs in the area as well. So respite is something that I always encourage. And I really like educating my families on caregiver support groups as well. So there are numerous caregiver support groups in our community, not just in person, because it can be a challenge having to coordinate care if you're leaving your loved one at home. So, there's in person, there's also virtual support groups as well over Zoom on the computer. And there are also some caregiver forums as well, kind of like a chat group where caregivers can go at any time of the day and talk about things with other caregivers in similar circumstances. So it's all about encouraging my caregivers to connect with others, to learn about what may be coming down the road, and to exchange information on different resources and services available in the community.
Yeah, so important. Yeah.
It's interesting because we tell people oftentimes, if you've seen one case of Alzheimer's disease, you've seen one case of Alzheimer's disease.
Oh,
Exactly.
Meaning
gosh.
that every circumstance we encounter is different.
Oh, yes.
And so having that support with other people who are going through it, as Christina mentioned, I think is just a critical piece of how do you get through that on a day-to-day basis? What happens if this occurs? Or, other people may have experienced similar things or may have experienced different things, and they may have strategies on how to deal with that.
Yeah.
Absolutely.
Yeah. Learn from others.
Yes.
Yeah, and that is something that the program you can help to give the caregivers those resources and connect them. Yeah.
Right.
Sam, we talked a little bit about the caregivers, how this is an incredibly stressful job, and I'm wondering how does that affect the caregiver health?
It's really individual. Some people have had some caregiver experience, and so they may be more comfortable in that role. But you can imagine for somebody who doesn't have that experience, how stressful that would be. And just the stress alone might increase their blood pressure, make it difficult for them to get a good night's sleep, things that would start to impact their health. And Christina mentioned, and I would totally support, to try to find ways to help caregivers not neglect their own health. Got to get out, do some exercise, focus on good nutrition like this. All of those things I think are critically important for the caregiver, because it really is stressful. And there was a study about 30 years ago, roughly, that identified that being a caregiver was actually an advantage for extended life. So if you were a caregiver, you might actually enjoy a longevity as a result of that. That was 30 some years ago. As we've lived longer, as our caregiving requirements have become more demanding, and sometimes our isolation, particularly during a pandemic or something like that, becomes more pronounced, it turns out that the studies that they've done since then to try to duplicate that or replicate that finding have shown just the opposite. That to be a caregiver in this day and age, especially over a long period of time, actually has a detriment to your lifespan.
Wow.
You actually would live less long, obviously, if you were trying to be a caregiver as well. And so we often ask the tough question in the work that we do for the caregiver: if something happened to you unexpectedly, what's the plan? What would you like to see, or what would your needs be for the safety and security of your loved one? And Christina functions very much like a social worker in that role.
Yes.
And and it's a wonderful thing for people to be able to take advantage of.
Yeah.
Yes, absolutely.
Well, I know you mentioned earlier that the caregivers are heroes, really. They're unsung heroes. They don't really get the recognition or the support, and just realizing that their own health is in jeopardy
Right.
is really an important piece.
And they don't get a lot of social contact. We
Right.
find situations where,
I'm going to grab
a
these.
little bit more,
Yeah, go ahead.
we
Yeah.
find situations where the caregivers also may be showing signs and symptoms of cognitive impairment.
Oh,
And that may be related to limited self-care. It may be related to the fact that they've forgotten to take their blood pressure medicines, or haven't gotten their blood pressure medicines refilled, or aren't sleeping well, and so they're not getting that 7 to 8 hours of recommended sleep at night because they're up taking care of their loved one throughout the night. All of those things are going to start to impact the caregiver's cognition as well.
Oh, yes.
oh my gosh.
So
Yeah.
it's always a little frightening for us to walk into a situation where we think we're seeing one patient with cognitive impairment, only to find that there's really two people in that dyad that you talked
Right.
about.
Right.
Yeah, and their focus is on the other, and I imagine it's even hard to get them to, get themselves to a doctor to even assess anything.
Right.
Yes.
Right.
Even for a regular checkup.
Mm-hmm.
Yeah, it's such important work you're doing. So I just dumped everything on this sheet pan, as you can see, and gave it a good, nice little sheen of olive oil. And then, excuse me, I'm just going to tuck in this feta. And what's kind of neat with the feta is as it cooks, it browns a little, it softens, and adds just a pop of color.
Yeah.
In addition to those little lemon slices, they'll cook and brown as well, and it's sort of like a little surprise when you get one of those lemon slices and a little feta. It's really wonderfully delicious.
Looks
Yeah.
great.
So yeah, just pop it in the oven, 400 degrees, maybe 25 minutes or so.
Okay.
And I'm gonna set this aside and grab one out of the oven.
All right.
Excuse me.
Yeah.
And so this is how it looks. So you wanna cook it until things are nicely toasty and browned. All those tomatoes have melted.
Smells delicious.
Yeah,
It really does.
makes a little sauce. And then I like to just sort of tuck in some fresh basil leaves. And that gives it a nice pop of color and pop of flavor. And nice bright dish. So Sam, both of you actually, what else do you want? What else do you want people to know about the work that you do?
Well, I would start by saying that we're very grateful that Dignity and YRMC have made this program a priority.
Yeah.
I think it's so important for our community, as we talked earlier, and the demographics of our community in terms of needing a program like this. And I don't know of any other programs in this area or region that really are as comprehensive as Christina's program is. I would also want people to know how accessible it is. A lot of times people are hesitant they assume that there's going to be an associated cost or that they need a referral or something like that. Christina's program, you can get a referral from your physician to come to the program, but really you can also self-refer. So if there are individuals at home, you can talk a little bit about some of the requirements of the program, but
Yes,
the
absolutely.
caregiver component is really important because one of the goals of Christina's program is to help people stay in their home setting where we know they do better. And UCLA, who disseminated this program to our area, watches those statistics to see what kind of results we're having with the program, to see are we able to keep people's quality of life better and keep them at home longer where we know they do better. And it keeps the costs down too. You can imagine when you have to institutionalize a loved one, the cost of care starts to escalate dramatically. So it's a valuable program, it's easily accessible, and I think that's probably the most important thing to know.
Yeah, so people can self-refer, it's covered by insurance. I think we have the number here that we'll share in a minute for how to connect with the program. Christina, what do you want people to know more about?
Yeah, in addition to that, I would like them to know that there is more support, there is more help available. I like that my program, I'm given a good amount of time to sit with my patients and their caregivers. We have an initial visit that's at least 90 minutes long. So I'm really able to sit down and hear their concerns or just allow them to kind of vent to me. And I think that that is valuable because, you know, other providers, healthcare providers, don't necessarily get that large amount of time allotted to them during their healthcare visits. And, you know, that's just the way it is, unfortunately. But, you know, I want them to know there's support available. We want to help them in whatever way possible, whatever that looks like. And yeah, just come check us out. Self-referral, covered by insurance.
And establishing those relationships early with Christina helps support people over a longer period of time.
Yes.
It's like even the individual with dementia will start to recognize Christina, know that she's a person who cares about them and is a safe person to be with.
Yes.
As Christina does home visits, they get more comfortable with having somebody in their home. All of those things that hopefully can sustain somebody over a long period of time with this type of caregiving.
Right, right. It helps to get to know the family early on and then be there for them throughout that dementia journey. That's imperative. It can make all the difference, really.
It's such a unique disease journey, unlike anything else. So what incredible work you're doing.
Thank you.
For folks in the community. Thank you again. Thank you again for joining us.
Yes, thank you for
Thank
having
you
us.
very
Yeah,
much.
really appreciate it. Just another mention about our dish here. This can serve as a side dish alongside our nice roasted chicken or a big salad. You can have it in a bowl with I love it with some French lentils, with some nice hearty bread, maybe with a side of pasta. There's all sorts of ways to serve something like this. So it just doesn't have to be this. You can add other things to it.
Yeah, absolutely.
So you can find out more about the Dignity Health Alzheimer's and Dementia Care Program at yrmc.org and by calling 928-327-5504. And in addition, please be sure to check out our prior Your Healthy Kitchen episodes on self-care for caregivers and the Alzheimer's and Dementia Care Program. Dr. Downing has graciously shared his wisdom as a guest here before. And you'll find those videos and 100 different ways to prepare easy, affordable, nutrient-packed meals at yrmchealthconnect.org. And you can also follow me on Facebook, where I post photos and videos of the meals I make at home, plus links to my favorite food and gardening destinations on the web. So until next time, eat well and be well, and we'll see you soon. Try.